Okay, so let's begin. So this is going to be an exciting session, I think, for the faculty and the trainees. My name is Slava Appelman. I'm the Peter Munk Center Research Director, and today I'm the host for this session. So it's a wonderful opportunity to meet two scientists who also are reviewers for your papers and editors. So Dr. Sumanth Prabhu is the Lewin Distinguished Professor and Chief of Cardiology in the Division of Medicine at Washington University. He's also the Chief Cardiologist at Barnes-Jewish Hospital. His lab studies the role of immune inflammatory mechanisms driving heart failure and cardiac remodeling. And today he's here with us as is his role as a Senior Associate Editor at Circulation Research. And I'll also take this opportunity to introduce Dr. Candace Silversides. And Candace is a Professor of Medicine at the University of Toronto and cardiologist at Toronto General Hospital. She's also an internationally recognized leader in cardio-obstetrics and adult congenital heart disease. She is the inaugural editor-in-chief of JACC Advances. So we'll start with a presentation by both. Different aspects of the publication process, things to do, things not to do, and then we'll move into an interactive question-answer period. I have my own topics, and we've received some email topics, but please think of questions while the speakers are talking. Think of questions you've had in your own mind about your own publications, how to interact with editors, and please feel free to ask. So with that, Sumanth.
So good afternoon, or morning still. Thanks, Slava, for the invitation and the center for the invitation. Before I get started, how many in the room are early career scientists or investigators? Could I just? Okay, so a good bit. I'm really happy to present on behalf of Circulation Research. This is one of the part of the portfolio of AHA journals, and it is within the AHA family, and dare I say beyond the AHA family, the #1 journal dedicated to cardiovascular basic and translational science. Jane Friedman is our editor-in-chief, and just a few basic facts about Circ Research. Who's on the masthead? I want to give you the cast of characters that may or may not be handling papers, the papers that you submit. We have our editor-in-chief, which is Jane. We have a deputy editor and senior associate and associate editors. We have consulting editors, especially if there are conflicts with our own associate editor group. And we also have editors for social media. We have managing editors that handle the journal day-to-day operations. And we have a very large editorial board whom we call on to do reviews for the papers that we receive. We also have part of the portfolio statistical editors who are doing their job when they're being picky for data and ensure rigor and reproducibility, and technical editors who are looking at the experimental protocols, documentation, and so forth. So this is our time to first decision in 2025 versus 2024. You could say that we average about a couple of weeks, 14 days for time to first decision. This is broken up into original research letters, which are abbreviated papers with just one figure, and then the average. The reason the research letters are much higher in 2025 is that we accepted research letters for the first time in our Compendia series, which is a constellation, a group of reviews regarding one specific topic. And these were slower to be reviewed for the Compendia, which are special issues. But as the year goes on, we'll fall back into that 2-week range for time to first decision. So it's a fairly rapid turnaround time for manuscript. This is our overall original research submissions. You can see that aside from the spike up in the COVID years, we're generally running between 1,300 and 1,500 manuscripts that are submitted for original research. And this is our acceptance rate. So In 2014, we were quite low, around 8% acceptance of our manuscripts. This has crept up over the years. You could see that we had targeted about 10%. We are generally in that range. Last year we were up to, I believe, about 11% in terms of our submission acceptance rate. So what's happened to manuscripts from Canada? So this is the acceptance rate for original research from Canada. And you can see that there's been a steady upward increase in the percentage of manuscripts that are submitted to Circ Research that are accepted from Canada. In 2019, this was quite low, 2%, and you can see that it's over 20% now year to date in 2025. I would like to encourage submissions from your group to Circulation Research. You have an outstanding research program here. And we would love to see more submissions come from the group here as well as across Canada. The denominator, I believe, I don't have that number, but the denominator remains fairly low in terms of the number of manuscripts submitted from Canadian academic institutions. So please send us your papers. And in case you're interested, these are the top 5 most downloaded manuscripts with Canadian authorship so far this year. This is a dynamic slide, so this will change as the year goes on. But you could see that it spans the gamut from platelet biology to vascular biology to myocardial biology, endothelial biology, and so forth. So, especially for the early career folks, an overview of the submission process. What is the author's role? Who handles the manuscript? What's the process? Comments, revisions, rejections. We'll go through that. So the first thing to understand is that there are different pathways to submit a manuscript to Circ Research or any AHA journal for that matter, and that there is cross-communication often between editors for specific manuscripts. So when the manuscript is submitted to an AHA journal, it may be referred to another AHA journal if the editor feels that the topic is more suited for that journal. And this can happen either before the manuscript is sent out for peer review or after the comments are received by the reviewers. And so this is a editorial judgment as to the appropriateness and fit for the science for that particular journal. So it can be submitted, for example, directly to Circ Research if you have a paper, but it can also be submitted through the AHA Journal Submission Portal. And you can rank choice the journals that you want for consideration for your paper. So right now, the AHA portal has 5 journals, ATVB, Circulation Research, Hypertension, Stroke, and Stroke Vascular Interventional Neurology. And depending on the topic, when I am pinch hitting for Jane in the editor-in-chief role, I will often see papers that are ranked between ATVB, Circ Research, Hypertension, and JAHA. JAHA is not on here, but should be. And it can be then really considered at all 4 journals for proper fit. So either way is fine. We're seeing now a much greater use of the AHA Journal Submission Portal, and I'm told that ultimately this will expand to most of the cardiovascular journals at AHA, much like is done now at Cell and Nature, for example. So what are the things to think about when submitting to Circ Research? We do have a high standard and high bar for science. We are really focused on discovery science as well as mechanistic and translational science. This is a little different from circulation, which really wants more of a translational bent. We also take translational papers at Circ Research. Usually there's more of a mechanistic aspect and mechanistic underpinning that is defined and delineated in those papers. So really, we are looking for novelty. Is there mechanistic insight? And is it significant? Now, novelty and significance are 2 things that may not necessarily need to be high on both ends. It may not be novel, but it may be highly significant from a standpoint of translation, for example. It may be descriptive, but it may show a data set that is going to be used in an archival fashion for multiple investigators subsequently. These are all of the things that we consider as to whether or not this manuscript is a good fit for circulation research. So novelty, mechanisms, significance, and I should say usefulness to the field. The cover letter and reviewer recommendations. So if I look at a manuscript, there are really three things that I jump to right away. The first is the cover letter, actually, and this is your opportunity to state in a very succinct and clear manner why is your paper important. If you don't advocate for your paper succinctly, nobody else is going to. So the cover letter is very important for the editors to look at and see what is the author trying to convey in this paper and what might be the importance of this work. So really it's important to emphasize what is important and what is novel about your work. And you are free to suggest as many expert reviewers in the field that you might suggest to review your paper. We rely on our editorial board very often. So if there are editorial board members whom you think might be suitable reviewers for your science, it often helps to put editorial board members there. And you can even put associate editors there, and that's one way to perhaps, it might fall into our lap in terms of which paper we handle. So, these are all things to consider. And so the first thing I look at is the cover letter. The second thing I look at is the abstract. So, when we're writing papers from the scientist standpoint, I don't know about you, we usually write the paper, we get the figures together, write the figure legend. The abstract's usually the last thing that we write. It makes sense. But actually, it's quite important to garner attention. So pay attention to your abstract. Really should be very clear and concise. We have a standard operating procedure for breaking it into 4 sections: background, methods, results, and conclusions. And it should really provide a summary of your findings and, importantly, the importance of your findings in the abstract. So you just want to say it again in your abstract, what you say in the cover letter as to why is your paper important for circ research. Then the third thing that I go to are the figures. And usually you can get an appreciation for the depth and breadth of the science that is performed by looking at the figures and the figure legends. And so the manuscript obviously will be reviewed in depth by the reviewers that we solicit, but the initial decisions are often based on evaluation of the cover letter, the abstract, and the figure legend. So keep that in mind. We have multiple abstract paper types, manuscript types, including original science, which is our most voluminous. We have reviews, which are usually commissioned. Sometimes we get uninvited reviews. Usually it's commissioned reviews. Editorials, research letters, which is a brief, usually 1 or 2 pages, and 1 figure. This is really nice for very circumscribed studies that want to convey one message perhaps as to why this is a important science. The bar is still the same for research letters. We do want it to be, is it novel? Is it significant? Is it mechanistic? You're not going to be as much detail as a full paper. And if you can't convey the importance of your science in that abbreviated format, it might be better to do a full manuscript. I'm actually going to skip this unless people have questions. This is all on the website in terms of submitting the paper. It's everybody's favorite tedium there. And so what happens to a paper after it comes into our lab? So first off, it's reviewed by either the editor-in-chief or one of the associate editors. The associate editors are assigned papers by the editor-in-chief. So as a senior associate editor, I sometimes will fill in for Jane when she's busy and so forth. We get a lot of papers. We get papers through the portal. We get papers through direct submission. We also have inquiries about the whether the appropriateness of a paper for a particular, for circ research, and so forth. So again, it's very important in your cover letter and your abstract, why is this paper, why is it worth the read from the readership of circ research? So really important to keep that in mind. Now, depending on the topic, the depth of breadth and depth of science, a decision initially about significance and so forth, it might be rejected. It might be referred to another journal, as I talked about. It might be assigned to a triage reviewer. And the triage reviewer is an initial kind of review by one reviewer to decide whether or not this paper should be sent out for full review. Or it might be sent out for full review. And so those are the possible pathways that can occur. We take each paper extremely seriously and consider all aspects. We get a lot of papers, so you saw the number of papers and the ultimate submissions, the ultimate acceptance rates. So we do have to triage appropriately and try to find the best home for papers if it's not at circ research. And we try to select out those with the highest novelty, significance, and mechanistic work to be considered for circ research. We do have a joint discussion between all of the associate editors and the EIC every week, and all manuscripts that undergo a decision that are not rejected outright are discussed as to why this may or may not be important. So it's really a group effort for these papers. So the review process, we saw the numbers. Generally, from the time to editor assignment to initial reviewer, it's 48 hours. Additional reviewer suggestions, another 24 hours. And then time from receipt of the final review to a decision is generally about 48 hours. So we're on a quick time frame. The wait is usually waiting for the reviews to come back. We generally suggest 8 to 10 reviewers for each manuscript. And we give reviewers 14 days to provide a review. So this is why we have a general 2-week decision time frame for our papers. So if it's time for first decision for a full review, that generally takes a little longer than 14 days. It's usually on the order of about 3.5 weeks. So this is the process. There's internal checks by the managing editor on new submissions. Generally, this will be 1 to 5 days. Peer review, we ask for 2 weeks. Sometimes it drags on to 4 weeks, depending on the responsiveness of reviewers. Within a few days, a decision is made. Then it gets sent back to the author if revisions, decide on revising it and submissions, and it's up to the author. We have a decision that could be reject, major revision, reject de novo, or minor revision. For first-time papers, it's very rare to have an accept. Well, it has happened, but usually it is a major revision, reject de novo, or reject. Reject de novo implies that the reviewers and the editors feel that there is a lot of extra experimentation that would need to be done to make the paper competitive for circ research. So generally, this is an open-ended time frame for if you decide to do the experiments and submit it back for consideration. A major revision implies a 90-day window to resubmit the paper. Generally, the necessary experimentation is not as extensive, and it may be things like data presentation analysis and so forth. And then if there's subsequent peer review of the revision, another 1 to 4 weeks. Circ Research publishes online once it's accepted, so the time for online publication is quite short, and so within 2 weeks it'll be online. So for submissions, the process is slightly longer, obviously. For submissions, you really want to provide a detailed response to reviewers. It's your call as to whether or not you want to address every single point from the reviewers. Generally, I personally, as an author, try to do that, but sometimes it's not possible. If you don't do it, argue your point as to why that wasn't done and why it is not necessary. For the managing editor, we want to address all formatting and file requests. So when your manuscript is accepted, yay, Circulation Research publishes online ahead of print. So make sure your final revision submission is actually complete. That's what's going to go out to the world before the galley proofs, et cetera, are done. And address any outstanding items, and we're happy to share and promote your article on social media. If you have a Twitter handle, Instagram, so forth, they will ask that and promote the paper on social media as well. So we do have an emphasis on rigor and reproducibility. This is really an initiative across all major academic journals. This is why we have a statistical and technical editor review every paper that looks like it's going to be accepted, and this is really to ensure, can this science be reproduced? Is the data appropriate? Is the statistical analysis appropriate? And so forth. And using a preprint server is fine as well. So bioRxiv or medRxiv is often used. And that's all I have. I'll be happy to take any questions during the question and answer period. Thank you.